Bysiewicz, and I'm the Lieutenant Governor, and I want to welcome everyone to the Interagency Council for Ending the Achievement Gap. This is our March 7th meeting, and we appreciate everybody joining us. We hereby call our meeting to order, and today we're going to discuss the state's response to health and respiratory illness in children and the success of the learner engagement and attendance program. And we are very delighted to have representatives from the Department of Public Health, State Department of Education as well, and those leaders will begin and lead our discussion today. We're then going to have a brief legislative roundtable where our member agencies can identify legislative initiatives that we as a council should be watching as they go through the process. And so now we'll just go ahead and begin. And Kari, if you could do the roll call, please.
Absolutely. I'll start with the Connecticut State Colleges and Universities.
Stephen Hagedis here from Southern Connecticut State University.
Department of Administrative Services.
Good afternoon, everybody. This is Doug Casey.
Department of Children and Families.
Matt Follen here for Department of Children and Families.
Department of Economic and Community Development. And Department of Housing.
Shantae Hanks here. Good afternoon for the Department of Housing.
Department of Public Health.
Hi, it's Dr. Lynn Sosa.
Department of Social Services.
Andrea Barton Reeves.
Judicial Branch. Office of Early Childhood. Office of Policy and Management. And the State Department of Education.
Thank you, Kari. Charlene Russell Tucker, Commissioner of Education, and I'll also make space for other team members to introduce themselves.
Hello, John Frastinelli, Division Director, School Health, Nutrition and Family Services at SDE.
Ajit Gopalakrishnan, Chief Performance Officer, Department of Education.
And I'm Kari Sullivan, Education Consultant with the Connecticut State Department of Education. Is there anyone that we missed in our roll call this afternoon? Okay.
I do have one new member from the Department of Social Services, Talitha Coggins, who just joined.
Great, thank you.
And Kari, do we have anyone with the Department of Economic and Community Development? I did not hear anyone.
No, we don't. I did receive an email that they were not able to attend today.
Okay. I understand from Alexandra Daum, our new DECD commissioner, that she has appointed Takawa Omara Otunu, Arts Education Manager, to represent DECD on the council. So we can keep that in mind. And I want to welcome our DSS Commissioner Designate, Andrea Barton Reeves. Andrea, thank you for joining our council. And I think she has her designee there as well. Is that right, Commissioner?
Yes, that's correct, Lieutenant Governor.
Okay, great. I think we can now move on to review our agenda on the PowerPoint. We have just completed our opening remarks and roll call, and in a little bit, I will ask for approval of the minutes as we review council updates since our last meeting. After updates, we're going to go right into our discussion on health and respiratory preventative measures, which will be facilitated by DPH's Dr. Lynn Sosa, who's the acting state epidemiologist and acting director of infectious diseases. Following that presentation, we're going to go into our discussion on learner engagement and the attendance, the learner engagement and attendance program. The acronym for that is LEAP, and that is going to be co-facilitated by Commissioner Russell Tucker and the division director for the Bureau of Health, Nutrition, and Family Services, John Frasinelli. And during both presentations, we would welcome the active engagement of our council members. And we're going to continue to follow the same format that we have in our past meetings, where we address policy recommendations from the 2014 master plan, and we ask for input from our council members. So feel free to jump in with any questions, anything you would like to add that you think is relevant to our discussion. And then after the presentations, I'm going to ask each of our council members to identify any legislation that their agency is working on, which they believe the council should keep an eye on. So I think it's important that we follow the legislation so we can continue to find ways to work with our legislative partners, because often they are working in tandem with us. So with that, we'll discuss next steps, including a review of the rest of our 2023 meeting schedule. Anybody have any questions about the agenda? Okay, if not, we're going to move on to follow-ups from our last meeting. We last met on December 13th, 2022, and we reviewed the oversight and administration of education in our juvenile justice facilities. And we also took an in-depth look at the fatherhood initiative work in DCF. The minutes of our December 13th meeting were circulated to the council in draft for your review. We did not get any suggested edits to the minutes, but if you have any corrections or suggestions at this time, please let us know. Anybody have any suggested edits or changes? All right, seeing none, are there any objections to accepting the minutes as presented? All right, and I'm not seeing any objections. So the December 13th minutes are hereby accepted as final. And any other questions before we get updates from our December meeting? Any questions or any other updates? All right, so seeing none, we're just going to go right to Dr. Sosa to start us off on health and respiratory preventative measures. Dr. Sosa, thank you so much.
Thank you, Lieutenant Governor. Can everybody hear me okay?
We can.
All right, excellent. So I'm just going to take the next few minutes just to kind of give everybody a status update on where we stand with viral respiratory diseases in Connecticut and what our approach to them has been, since it is a little bit different this year. So next slide. So this is really the first year since the onset of COVID-19 where we've been dealing with multiple respiratory diseases at the same time. And so I'm sure people are familiar. We're going to be talking about RSV, or respiratory syncytial virus, influenza, as well as COVID-19. And they're all a little bit different. So RSV, just as a review, is a virus that generally causes mild cold-like symptoms. And the folks that it most affects are very young children, infants, as well as older adults and those with underlying conditions. This is a disease that's been around for a very long time. And most people, because it's a mild illness, don't go to get tested. It is often what many of us would attribute to as having a cold. And in terms of schools, there is no and has never been RSV specific guidance. So usually schools would employ their usual guidance. As long as a student is fever free and feeling well enough to be at school, then they can go to school. And in terms of our approach this year, and really the goal has been trying to integrate the preventive measures for these 3 main respiratory diseases. And so we're at the point where masks are still something that people can employ if they have symptoms. And that was something that was suggested for somebody, again, who had mild symptoms. We wanted people to be in school. And so if people felt more comfortable wearing a mask, they could do that. So let me go to the next slide and just talk about where we stand right now with RSV. So this is a figure that is showing data from the National Respiratory and Viral Enteric Disease Surveillance System. So this is basically a consortium of laboratories that voluntarily report data to CDC. And so basically you have kind of that purple line, which is showing data going back actually to 2021 and kind of showing you actually in the fall of 2021, we had that little bump, but we had a really, really big increase in RSV in terms of what laboratories were reporting in the fall of this year. And that coincides with all of the reports that we saw in the news and things like that. But the next slide actually shows us kind of how this compared to previous seasons. And so this slide is actually showing RSV related hospitalizations. And this is showing data from 10 states that do specific surveillance for hospitalizations related to RSV. So these are people who tested positive for RSV and were in the hospital. So here we're able to actually compare data going all the way back to 2018. So the current RSV season, starting in the fall, is in green with the green dots. And you can see here that we had a much earlier season and well as a lot more hospitalizations related to RSV, certainly compared to the previous 4 seasons. And so this was definitely a different year for us, not only in the timing of what we were seeing related to RSV, but also in terms of the magnitude. So definitely seeing a lot more people, not just with RSV in general, but a lot more people, unfortunately, that were hospitalized. And so, you know, we've been dealing and talking a lot about COVID-19 for the last couple of years, but this fall, this was really the first time, along with COVID-19, that we were also really talking about another virus, in this case, RSV. So this was really, I think, one of our first challenges for the current respiratory viral season. So good to know that right now we are seeing very low levels of RSV. So if you can see there, we're into the end of February, and we're very low right now in terms of RSV, which is great. So next slide. We'll talk a little bit about influenza. So next slide. So influenza, I think, is something that everybody is very familiar with. Flu is generally something a little bit more severe than, say, an RSV type illness. So the definition of influenza is having a fever with a cough, and that can include a sore throat. It may not, but most people do often have a sore throat. And influenza, again, most often more severely affects persons at the extremes of age, so very young children, older adults, as well as persons with underlying disease. Now, influenza is different than, say, RSV because we often do want people to get tested, and there have been rapid tests that doctors have been able to employ in their office. And the reason for this is because we do have medication that people can use either to hopefully decrease a little bit the length of time that they might be sick, because unfortunately with influenza, you can be sick for usually about a week. People are sick with influenza. But then there's also medication that people can take if they are exposed to somebody with influenza to hopefully prevent them from getting sick. So for this reason, testing is more important for influenza. Again, when we're talking about schools, there's never been really specific influenza guidance. It's really been focused on people as long as students and staff were fever-free and feeling well enough to go to school, they can go to school. So next slide, where are we at with influenza this year? So this is just a snapshot of our DPH influenza dashboard. So for many, many years now, we have been reporting our influenza data. We have called influenza season October to May. And that's consistent with how national reporting from CDC is for influenza. And so this year we're able to kind of give we've switched from a kind of a PDF page report to this active dashboard, which we have here right now. So here we're able to show cases, hospitalizations, and death at the top. We are able to compare the current season in black to previous seasons, and that is actually showing the percentage of visits to emergency rooms for people with influenza-like illness. So again, looking at people who have fever and cough with or without a sore throat. And again, similar to RSV, if you look at that black line compared to the other years, we saw an earlier season for influenza. So influenza usually peaks in January or February. And we saw a peak in early December this year, which is definitely earlier than we usually see, although it can happen. And again, kind of trying to compare that to the last couple of years where we've had COVID-19 is really tricky. The probably best comparison in that figure is actually the green line, which is the season that immediately preceded COVID-19. So we've had our first cases of COVID-19 in Connecticut in March of 2020, and that green line is reflecting the 2019-2020 season. And you can see that we actually had a little bit of a higher peak right before we started seeing COVID-19 in Connecticut. The thing I will caution with influenza is that people might have heard that there's an influenza type A as well as an influenza type B. And sometimes you can actually get kind of two peaks of influenza in a season. Usually the first peak is influenza A, and that's what we did have already seen this year. And then you might get a second peak of influenza B. So we are not seeing that yet, but we're certainly on the lookout for that. So here in that vein on the bottom of this graph, you can see the types of influenza that we're seeing. And not every influenza test is typed, but most of it, as you can see here for that light blue, is type A. And the orange is reflecting type B. And so we've seen a little bit of that. There's always both circulating, but type A is generally the one that we're most focused on, and usually what is the most common strain that is circulating in a given period of time. So the next slide is just showing our hospitalizations related to influenza this year. And we definitely, consistent with the time that we saw the most number of cases of influenza reported to us, we also saw high numbers of people hospitalized with influenza. And the bottom part of the graph is just showing, again, the age breakdown of people who are hospitalized with influenza. And as I said before, generally it's persons at the extremes of age. And so unfortunately, we do see children hospitalized with influenza every single year. And then the last slide, I think, related to influenza, which is the next one, are our deaths. And again, just looking at when deaths have occurred. So far this year, we've had 66 influenza-related deaths reported in Connecticut. So next slide. And then this is just showing kind of where we are right now with influenza-like illness across the United States. So light green is showing low activities of influenza, and then the darker you get in your colors, the higher the level of influenza is. So right now, and this is data as of last week, we're actually seeing relatively low levels of influenza-like illness in the United States. You can see that there are some states that have more active influenza-like illness right now, especially in California and the Southwest. So again, this is something that helps us understand if we might start seeing increases in influenza-like illness as well. So next slide. And then certainly, finally, but not least, we are still certainly very focused on COVID-19 and where we are going with that this year. So the next slide is just kind of giving the overall snapshot. So we have cases, our hospital census, our new admissions, and our deaths. And this is showing the data from the entire pandemic. The current years for 2023 is shown in purple. And so I think the overall message from this is that certainly compared to the other years of the pandemic, we are definitely seeing lower number of cases, although we certainly have less cases reported. Many people are doing home tests, which aren't reported to us. But importantly, seeing fewer people hospitalized, fewer people admitted to the hospital, as well as fewer deaths. And these are all good things as we have had now several years of experience with COVID-19. We have vaccines and we have therapeutics, which are all really important tools for COVID-19. So next slide. So this is just showing our cases for the last month or so. So the blue bars are the number of cases by day, and the red line is the 7-day average of cases. And again, even though we have fewer cases reported to us overall, because many people are testing at home, I think looking at the trend and the fact that we are continuing to see decreases is really important. And that's a really good thing, something we're really happy about. Next slide. And then just looking at the age groups of people who are affected currently by COVID-19 over the last month or so. And I think the main thing here is that at least at this point, COVID-19 is affecting primarily older persons, as it has severely impacted our older populations throughout the course of the pandemic. And right now that continues to be the case with our lowest number of cases occurring among our children. Okay, next slide. So this graph is showing, again, the entire pandemic and showing the hospital census at different points throughout. And so you can see that right now our hospital census is continuing to decline, which again, we are really excited about. You can see kind of what our peaks were during the pandemic. So our highest number of hospitalizations was very early in the spring of 2020. And then with Omicron last January, a peak almost as high. But we're just really glad that at this point we are continuing to see decreases among persons hospitalized with COVID-19. So all going in the right direction. And again, similar to just overall age groups of people who are affected by COVID-19, the people that are most likely to be hospitalized with COVID-19 are going to be our older age groups, and that is reflected here. And then next slide. That said, we certainly are continuing to monitor hospitalizations among our pediatric populations. And so we still do have kids hospitalized with COVID-19. But again, those numbers, especially in the last several weeks, appear to be going down, which is really great. Next slide. So this is just showing the CDC community level. So about a year ago, CDC put together 2 sets of data to help inform the public, kind of give people a snapshot about what was going on in COVID-19 where they lived. So what they did was they took a combination of case rates as well as hospital measures. So in particular, hospital bed utilization as well as admission rate, to come up with different what they termed community levels. And then they tied prevention measures to those community levels. So a green community level is the lowest. That means that case rates as well as hospital utilization as well as hospital admission rates are relatively low. Yellow is kind of that middle ground. So in that situation, either the case rates are high or hospital admission rates or utilization rates are high, but not both. When both are high, then you're in orange, or kind of the highest level. And so for green, it's basically, people just need to be aware of what's going on in their community. There's no specific recommendations in that situation. Above and beyond, washing your hands and covering your cough and things like that. For locations that are in yellow, that is a time when people need to be more aware. If people have underlying medical conditions, they would recommend it to consider wearing a mask, especially when they're out in public or with or in large crowded settings. And then when an area is orange, that is a situation where everyone would be recommended to consider wearing a mask to protect themselves, in addition to all of the other things that people can do. So again, this is another situation where we, over the last several weeks, have seen our community levels come down, where at this point we have most of the state in that green or lowest level of community level for COVID-19. Okay, next slide. So I wanted to show a little bit more specific data about what is going on among our youngest age groups. And so this is showing data that are reported by child care centers. And so they do report to us whenever they have a staff or an attendee identified with COVID-19. And so the yellow shows the staff COVID-19 cases, the blue are children, and then the red is just showing the number of child care centers that are reporting. And so again, not surprisingly, for this current season, we saw the highest number of cases in January. And since then, we have seen a decline among both staff and attendees, as well as the number of centers that are reporting COVID-19 cases to us. And then in the next slide is the parallel system for schools. So similarly, for the last few school years, schools report to us on a weekly basis their number of staff and students that they know to have COVID-19. And so here you can see that at this point, we have a relatively small number of schools reporting staff and students with COVID-19. So in general, as I mentioned, we have really tried to integrate our approach to the viral respiratory diseases, even though they are all different. A lot of the mitigation measures that we have been talking about, while there are some that are very specific to the disease. So for example, I talked about antivirals for influenza. We also have antivirals as well as vaccine for COVID-19. In terms of the other things that we can do, they really are effective against all, not only these 3 viral respiratory diseases, but all of the viral respiratory diseases. And so we've really tried to integrate that message to schools and providers and everyone. And so, especially understanding that during wintertime, is a time when we see increased transmission of all of these diseases because we're spending more time inside, there's more crowding, there's more people traveling, so there's plenty of opportunities for transmission. And so this has been the messages that we have been giving to people. And so a lot of this has been really just making sure that people are aware, like if people are sick, they should stay home, because that's the best way that we're going to prevent people from spreading particular illness. For COVID-19, the recommendations really have not changed. They're the same as they were for the last year or so. So if someone does test positive for COVID-19, they should isolate at home for 5 days after symptom onset or a positive test. And then after that, they can return to a school or work wearing a mask, assuming they are fever-free for 24 hours and their symptoms are improving. And then for the other respiratory diseases, so if someone tests negative for COVID-19, Again, there's no specific guidance on the number of days people need to stay home. You know, as long as they're well enough to go to school and are following whatever the school policy is, which is generally fever-free for 24 hours without fever-reducing medication, then people can go to school. And so this is going to continue to be the message that we give over the rest of the school year over the next several months. We try to not only focus on this messaging during wintertime, but also around vacations, right? Because again, people are traveling, people might be in a more crowded situation. And so trying to just make sure that people are aware of that so they can go on vacation and have fun and then still be ready to come back to school and work and be healthy. So that is where we stand with viral respiratory diseases. I'm happy to see my Department of Education colleagues. I don't know if they have anything they would want to add, and I'm happy to take any questions.
All right. So I am not seeing any questions. So Dr. Sosa, thank you so much for your very informative presentation. And we love that the numbers seem to be moving in the right direction. So we will stay tuned. We appreciate your work. And Charlene, I think the floor is yours.
Well, thank you, Lieutenant Governor. And I really just wanted to say I couldn't do this fast enough to get my hands raised. But I really wanted to share, certainly on behalf of the agency, appreciation for the work we've done over the past few years with the Department of Public Health in this space. And specifically, for those who don't know, Dr. Sosa, we're connected. I felt like at the hip every week, Health and Safety Tuesdays for an hour every Tuesday morning for I don't know how many Tuesdays, over 80 or 90 Tuesdays that we've done this. And I really credit that to the reason we were able to keep our schools in Connecticut open, because every Tuesday morning over that time period, or superintendents or school nurses or school medical advisors, they had a trusted source and a place to come to get all their questions answered. And I just really want to publicly, I talk about it often as the Connecticut difference and the best-in-class collaboration, which we sometimes take for granted. But I just really want to thank Dr. Sosa and the team at DPH that was with us the entire way. Now people know them by name. They know all our colleagues at DPH because they became the source that they reached out to be able to have schools safely open and our staff safely working. So I just really wanted to thank her and thank the DPH team and Lieutenant Governor, under the leadership of yourself and the governor, that really helped facilitate our agencies really working so well together on behalf of our state. I just really wanted to say thank you.
Appreciate that. And I will tell you that we had such a focus on public health and in particular on keeping our schools open. And I think all of us remember the many conference calls we were all on, whether it was the command calls or your education calls. So we appreciate everybody's leadership. So Commissioner, are you going to, along with John Frasinelli, present on LEAP?
Yes. Thank you very much. And it really is appropriate that we come right after this presentation, because when we talk about having our students in school and having our staff being able to work safely, that this is really so important. And then it really goes right into the issue of attendance. And so we're so thrilled to share with you information today about our Learner Engagement and Attendance Program, acronym LEAP. So, you know, the governor took a leap of faith in investing in this program because we were so concerned about making sure students were in school and engaged with all the kinds of things that were happening. We've traditionally in Connecticut made it a focus to focus on attendance because we recognize how pivotal that is for student success, for them to be in school and engaged. And so you'll hear more about the program, but we're just so thrilled. And this council is such an appropriate place for us to be having these conversations, because when we think about barriers and facilitators to attendance, it takes more than just us at the Department of Education and frankly, outside of the school districts, that they can't do that alone as they work with families and our students and the trauma of this last couple of years. So it's been really important for us. Good news is we're investing in this program, and you're going to learn today that this program is working and has become a national best practice in terms of the work that we're doing here. So you'll hear all about it. In addition to the Center for Connecticut Education Research Collaborative, CSERC as we call it, another education acronym. The reason we know that this is working is because we've got some really great researchers who are literally evaluating our investments that we're making. So with that, we've got a team here that's going to be giving us all the details of the program, but I'm just so thrilled to be able to give voice to and thank them and all our districts and all our partners working together in this space. So with that, I'm going to turn it over to John and Kari and Najib.
Thank you, Commissioner. Absolutely nothing to add to that. So we're gonna jump right in, and you'll learn about the success of this program, as the Commissioner mentioned, and you'll learn about how it's being picked up all over the country. And in the next slide, you'll see the organization that has developed a video to be used actually across the country to support other districts, in other states, and we're actually hearing from some provinces in Canada who want to replicate the LEAP program as well. So we'll open with that, give you a little taste of the folks involved in LEAP, and then we'll move right into some of the evaluation. Kari, go ahead.
The last 2 or 3 years since COVID, we've had a lot of children who've been out of school. Kids are just missing a lot of learning.
No matter what kind of strategies that we put in the classroom, no matter the quality of our educators, if our students are not there in person, connected and engaged, then learning will not occur.
When this COVID relief money was coming into the picture, the state of Connecticut did a really terrific job of sort of being mindful about how best to use that money to serve our population of students.
The LEAP project really was our answer to chronic absenteeism.
I don't know if Matt was on earlier, see if we can.
You can't hear them all, you hear it?
We hear it in double.
In double?
So maybe if you turn off your sound, Kari.
Okay. All right.
Let's try that.
All right. So I'm gonna turn, my sound is off, and I'm going to start it again.
Children who've been out of school. Kids are just missing a lot of learning.
No matter what kind of strategies that we put in the classroom, no matter the quality of our educators, if our students are not there in person, connected and engaged, then learning will not occur.
When this COVID relief money was coming into the picture, the state of Connecticut did a really terrific job of sort of being mindful about how best to use that money to serve our population of students.
The LEAP project really was our answer to chronic absenteeism.
I think LEAP was so successful because you had a trusted member of the community knocking on your door saying why we want your kid back in school. Her friends miss her. The teacher was asking about her. Any concerns you have, would you like to come and meet the teacher? Those personal contacts made a big difference in getting our kids back into the classroom.
LEAP stands for Learn, Engage, and Attendance. And that's the focus of the grant and the funding and the program, because we want students to learn and engage.
It starts with having conversations with families on how to get their children to school, but then it goes beyond that. I've been on home visits where families were struggling with finding food. They need resources for the baby. Their child is really struggling developmentally, having trouble with health issues.
As a home visitor, I really support the family. I go to their house and listen to them and care about them.
I have to push my daughter. I told her all the time, you have to be better than me. I was working in the factory. I have couple tuna in my both hands. I don't want it for my daughter. I wanted you to have a better job than me. Claudia heard my daughter go to school, and now she goes into college.
Home visiting for many years has had this connotation that it's punitive. LEAP has shown that there is a way to do home visiting that lifts up, applauds for what you're trying to do, but also reminding you that, okay, there might be something that you're falling down on, but how can we support you in getting your student back on track and in schools.
It's about that trusting relationship, because if that relationship is there, if the parent sees the value and the student sees the value and understands the value of what school is, then you see improved attendance. Then they want to come to schools.
The LEAP program led to approximately a 15 percentage point increase in attendance among those students who participate in the program. We're talking about an increase in attendance that is moving these students from chronically absent to an attendance rate that is more similar to other students.
The impact of just a single home visit on a child's attendance over time had an immediate impact of about 4% in 1 month, but 6 and 9 months later, that student's attendance was still improving.
The program actually was effective across a broad base of student attributes, including race and ethnicity, gender, free or reduced price lunch status, and even students with a disability.
With the infusion of a vast amount of money from the COVID relief dollars, it became necessary to have a mechanism to study how well these initiatives were working.
I think all of the evidence and the proof that we've collected shows, yes, absolutely, LEAP could and should be funded beyond these ARPA dollars, beyond the ESSER dollars. I think the data, though, is most powerful when coupled with those anecdotes. So the things you're hearing from on-the-ground home visitors, that's what makes it come alive.
Sometimes it's just one person to make the difference in the life of a child or a parent or a teenager.
Have we lost the sound? Because I'm not hearing anything.
I think that's the end of the video, Lieutenant Governor, I believe.
Okay, I just wanted to make sure that we still had audio. That was very powerful, and Connecticut continues to lead. It was one of the reasons why President Biden tapped Miguel Cardona, and we're continuing to lead the country on very innovative education initiatives.
Thank you, Lieutenant Governor. We're gonna dive into some of the details now. Kari, if we can go to the next slide. There we go. Just circling back on Dr. Sosa's presentation to look at some of the data. You'll notice this is a trend slide from the school year 2020 through January of this current school year. You'll notice that the trends mirror what Dr. Sosa was indicating in terms of this early, what you referred to as the early spike in respiratory viruses in November and December, not waiting until January and February to show up. And some of that impacted our students' attendance globally. And then you'll see in January, the numbers start to come down a little bit more. So that's what's currently happening. Just to resonate on Dr. Sosa's presentation, also want to echo the commissioner's comments about the incredible, valuable effort and work that DPH and Dr. Sosa and her team did throughout the pandemic. Again, connected at the hip, days, nights, weekends, and everything else. So really great team. Next slide, Kari. So, and again, what we refer to as sort of that triple respiratory threat, these sort of reasons or causes and challenges with regard to attendance came about as a result of conversation with our coordinators of our 15 LEAP districts in December. And certainly on the left-hand side, you'll see illness and stress and mental health. We sort of look at those as issues that have plagued all of our families, regardless of economic status, regardless of race and ethnicity, or where you live in the state. Folks were facing, the concern over the impacts of respiratory viruses, influenza, and COVID. Certainly, when LEAP started, shortage of mental health providers in the community, both the increase in behavioral mental health concerns and the challenge with finding adequate care in the state for that increase in school anxiety, what we refer to as school aversion or school avoidance. And then, missing school compounds itself. Missing school tends to lead to more missing school. Students don't feel like they're connected to school. They're sort of lost some ground. Makes it harder to jump back in and with regular attendance. But again, during the pandemic, we were focusing. I also want to acknowledge Doug Casey, who was a big part of our understanding of some of the issues that were facing families as early on in the pandemic. Our LEAP visitors were finding out that there were some technology concerns that we were working together with his team on as well. But access to housing, consistent housing, we had students who were working as part of making, money for their families when the adults in the household had lost wages or lost jobs entirely. The increase in the cost of food, et cetera. So a number of things happening, insults to regular attendance that were happening. And so we'll go to the next slide, Kari, and Kari's going to talk a little bit about the implementation of the LEAP program and how and why we started this program. And before I do that, I just want to acknowledge that Kari was driving the bus on this LEAP program. She was the one who held everybody's feet to the fire throughout this progress and deserves a lot of credit for this implementation and the success of this program. So Kari.
Thank you, John. I appreciate that. So the Learner Engagement Attendance Program in early 2021, the state collection of monthly attendance data showed an urgent need for capacity in districts to reach out personally to large numbers of students and their families who were chronically absent in the past school year and who were disengaged from school due to COVID-19, and to re-engage those families. We needed to expand people power beyond teachers, because the teachers did not currently have the bandwidth at the time to engage in outreach, given all the other responsibilities in their plate. So LEAP is people power on the ground for our districts and our schools. There was a statewide need for a common approach to conducting assessment of district and school level assets and challenges and analyzing collective results. So the other part of this was that the home visitors helped districts understand and address barriers to attendance. So the home visitors went out to help families, but they also came back to schools and school attendance teams with information that could help them make decisions around policy practices and what was happening with their family. The LEAP model was developed in collaboration with our RESC Alliance. I just want to give them a shout out, and Attendance Works at the national level. And it was based on research on existing home visiting models that are out there already to help create this model. The next slide. So families and their home visitors, well, the cornerstones of the LEAP model are key to our success. And so the LEAP mission is built on trusting relationships with families to ultimately positively impact students' engagement and attendance. It's a collaborative and flexible endeavor between families and students, and connection and support are key to the success. It's a data-driven model. This is done in partnership with school attendance teams and community partners, and looking at the data and what they're learning about what's happening with families and what are the root causes for why kids are not coming to school. And LEAP home visitors are trained through the Connecticut Home Visit Hub, which we've established at CREC. We have LEAP 101. We have LEAP Connections meetings where the LEAP home visitors support each other. The gold standard for home visits is that they occur in person and by a pair of trained home visitors. And then the next slide, I think I'm turning over to Ajit.
Why is it a pair of home visitors?
It's a pair of home visitors so that they one for safety, and one can help. We don't go in with a clipboard and take notes. So there's two sets of ears and two folks who can kind of troubleshoot and problem solve after the home visits. And it's not just a one-on-one home visit with families. There's always somebody there with the home visitor. Sort of a note taker or someone to help keep track of what they need to follow up on.
Great.
Okay. Thanks.
Thank you, Kari. Appreciate it. So as the commissioner mentioned before, and as you saw in the video, we commissioned an evaluation for LEAP through our Center for Connecticut Education Research Collaboration, or CSERC. And the full report on LEAP's effectiveness is at this link here. And this evaluation was led by really a team of 3 researchers. We had Dr. Steven Stemler from Wesleyan. He was the principal investigator. And then we had Dr. Eric Brunner from UConn, and a 3rd researcher from Central Connecticut State. So it was kind of a team effort among the 3 of them to do this work. And the lessons clearly, you heard about the 15 percentage point improvement 6 months after the first visit for families, and that is a huge impact. If you think about a student who comes to school, let's say 70% of the time, which means they come to school 7 out of 10 days. So they're missing 3 days every 10 days, right? So when you say a 15 percentage point improvement, that means that kid goes from coming 7 days to coming 8.5 days. Again, these are averages that we're talking about. So it is a substantial improvement for a particular child to see that extent of improvement, again, across this on attendance. And these impacts were noted across student populations, and as Dr. Brunner mentioned on the video as well. So how did this?
Can I just ask about the 15 points? Because at first I was looking at it and I was thinking, okay, well, is it that if 80% of the students were showing up regularly, then all of a sudden 95% of the students were showing up regularly? It's not that. It's for
each kid. Yeah.
Okay.
It's an impact for a kid. Now that will, that translates to that average that you're seeing. On average, if a class had 80% attendance, and let's say all the kids in that class got the LEAP intervention, and on average you see now 95% attendance, then you would see it for that group of students in that class. So it can work the way you're thinking about it, Lieutenant Governor. But when we're talking about this impact, the researchers actually compared the students who got the intervention, if you will, to other students just like them in those same districts who hadn't yet gotten the intervention. So it was really comparing as like kids as possible for this analysis. So it's a really robust analysis here. And what we also saw is that the impact on the elementary grades was actually a little bit less, whereas the impact in the middle and high school grades was actually much greater, significantly greater. So 10% roughly in the elementary grades and around 20% in the 6 through 12 grades. And this kind of gives you a visual of it. We had one district, New Haven Public Schools, that actually did not implement the LEAP model as designed. And what we saw is, if you look on the right side, you'll notice that pertains to New Haven Public Schools data. The red vertical line represents the time when the student receives their home visit. And what you see is prior to the home visit, attendance is flat. It's not sort of, the direction of the attendance is flat. And in the case of New Haven, what you notice is even after the intervention, the treatment, the home visit, the attendance remains flat. Whereas for all the other districts that actually implemented the LEAP home visiting model, you notice this upward trajectory after that intervention, sort of reflecting that prior to the intervention, they looked, it was flat, but after that intervention is when you see that that attendance actually increasing. And here you see it broken out by the 3 grades. You notice kind of for the elementary grades, the chart on the left, it shows a slightly less steep of a slope, if you will, in terms of increase. And each bar, by the way, represents a month after or before the visit. So every month you notice that consecutively sort of that upward trajectory, and clearly in middle and high schools, you notice that much steeper curve leading to that 20 percentage point increase in grades 6 through 12. And I noticed some questions are coming in. This is great. Let's see, Shantae Hanks, please go ahead.
Yes, thank you. Do we have New Haven's model, what was modified with the LEAP model that they did differently?
Sure, and I'll let Kari jump in here too, but the LEAP model is based on targeted home visits. The premise is that you identify the students who are chronically absent or having attendance issues, and then you visit you conduct a home visiting intervention with that individual. In the case of New Haven, it was more of a neighborhood canvassing approach, where they would just go in sort of largely in the neighborhoods and do that, whereas in the other districts, it was more of a targeted home visiting intervention. Kari, would you like to add something there?
With LEAP home visits, they're always scheduled ahead of time with the family so they know they're coming. And with this, what New Haven did was like Ajit said, canvassing. So they just sort of found, when they went to neighborhoods where there was really high chronic absence rates and visited families. And they also visited families where the chronic absence rates were very, very high. And they weren't as targeted. The same.
Thank you.
Mm-hmm.
Christine?
Another hand.
Is there a reason why New Haven was able to take a different approach and pretty much all the other school districts did not? Like, what was the logic for them to deviate from the way they were supposed to do it? And what made them think that they could deviate from what they were?
Because we didn't, do you want me to answer that?
Yeah, go ahead.
So I remember specifically the questions with New Haven around doing it a little bit differently. And they had this model in mind to address this issue when COVID was hitting their district so severely. And we were just building LEAP at the time. We didn't have research to show that this was successful. And one of the findings was that we were flexible with cities and districts to let them use what works in their district. And so the evaluation was one way of finding out that that was not a method that worked.
I guess.
Does that make sense? Does that make sense?
Yeah, it does. I think in the startup, we were sort of figuring our way as well. And when a district came to us and proposed they want to do this approach, we sort of, I guess, let them do it. But I will wrap this up by saying, the New Haven piece, by saying that, they have been excellent partners through this. And we took this data, even before the publication of this report, back to New Haven and had this conversation with them. And sure enough, this year, they're implementing the model as structured. So I think it was really an opportunity to conduct such an evaluation and have data in real time, so that we can actually go back and inform that, so that they could make those course corrections, if you will.
They've had all around 200 people trained in LEAP 101 in the home visiting model, and they are out doing it. And now they're champions of it. They're just super excited about it, and they're seeing the impact. And more and more teachers are interested in doing the home visits as they're seeing it's kind of caught on like wildfire there.
Thank you for adding that piece, Kari. That was my follow-up question. And ironically, I was in school in New Haven when the LEAP program started. So maybe that was the method to their madness, by having them show you what it would look like if they were to deviate. Now can, prove that the LEAP model works. So it's a good thing, I guess. Maybe that was New Haven's method to their madness.
Commissioner?
No, and I wanted to add, and thank you for this great conversation, because with all the investments that we're making using these resources, the ability to know what's working and get that information almost in real time as possible, so you can make course correction, is really important. And so, not to be dismiss is the fact that in Connecticut, with all the resources that we've got, we invested in this research collaborative. And I know Ajit didn't go into the details around it, but we're so pleased that we have private and public institutes of higher education in Connecticut who's come together to be a part of this collaborative, so that all the investments that we're making, especially with our set-aside funding at the state, we're looking at impact. So it's two prongs, it's accountability and it's impact. And we're able to then make course correction as necessary. And that is also something that has gotten attention across the country around this work that we're doing to make sure that our investments are indeed making an impact. Thank you.
Thank you, Commissioner. So this basically, again, just to wrap this slide up, shows the difference in impact between the elementary grades and the middle and high grades. I think Kari may have mentioned this, or or Eric Brunner might have mentioned this, that the results did not really differ based on the title of the individuals conducting the visit. So it could be a homework, social worker, support staff, administrator, teacher. The role didn't, at least in the data that we had, didn't show sort of a differential impact. Maybe in future years it might, but in the first year of the data, it didn't. And also the results did not differ based on whether the home visitor was from the school district or from like a community-based organization that the district might have contracted with. So, and that was also good for the districts here because different districts did do different things in that particular regard, going back to Kari's point of giving districts that flexibility. And I believe, Kari, you can take control back from here.
Great. Thank you. Thank you, Ajit. So this is one of the lessons learned from the LEAP evaluation, that when implemented with Fidelity, LEAP works. We had over 8,700 Connecticut students received at least one LEAP home visit. The model is for multiple home visits, that we go and we meet the families first before we talk about attendance, data, or behavior. Attendance, grades, or behavior. We always build a trusting relationship. We ask, how are you and how can we help in LEAP? And so we build a trusting relationship over time. The families and their home visitors noted 8 main benefits of LEAP. These were their perceptions as part of the qualitative. They found that the LEAP home visits improved. Ajit, did you have a question?
No, I just wanted to, before you get into the 8, I just wanted to acknowledge Dr. Jacob Warblow. He was the researcher from Central Connecticut. And if you read the LEAP report, you'll see that it's actually filled with qualitative feedback from the home visitors, from districts, from families, et cetera. It's a robust, it's lengthy, but it's really worth the read because you really get an insight into what it's like for the home visitors, for the districts, for the families to actually, get kids to come to school every day and succeed in school. And these types of points that you're seeing here that Kari is sharing, those are really coming from that qualitative research part, thanks to Dr. Jacob Warblow, who led that work. So I just wanted to make sure I acknowledged his work. Sorry, Kari, to interrupt, and please continue.
Somehow I changed my view, so I'm seeing everybody instead of the slides, but I can continue. So these 8 bullets here are, what the families and home visitors noted as the main benefits of LEAP. And what's validating about this particular finding is that not only does the LEAP model work when it comes to the data, the hard data, and the standard measures of attendance and achievement, but it works to improve all of the other areas that are so overlooked, that are often overlooked or not measured. Things like a student and their family feel like they belong and are welcome at a school. If they have a positive relationship with a school, these are really important pieces when we think of a whole child and their family. And their experience moving through our school systems. And knowing that LEAP is helping with this is, for me, really the best news of all. And the success is manifesting through these relational home visits. Families and children are feeling engaged, like they belong. It's kind of a lot different than our truancy model, our old truancy model, where we made families feel like they were breaking the law or doing something really bad because of attendance. It really is the story behind the absences that we're trying to get to. And the LEAP home visitors are helping us to get that connection with families that's trusting and positive. Thank you.
All right, so we're going to go to the last slide, and we're going to, I'll turn it back over to our commissioner to close us out. And any final thoughts?
Thanks, John. And this is just a list of the places where we've actually that have picked up information and story. We had a publication not too long ago in Forbes, posted on Forbes.com. And I like the Connecticut's funding what works in education, and they can prove it. It's a great title. And talking about what's been done here. And so those are just links for stories around the program. And we appreciate the Collaborative for School Success that was actually formed. Actually, the work that they're doing as a nonprofit is looking across the country at the investment of the COVID dollars and to see what's working and amplifying it. And so certainly Connecticut caught their attention, and they did a story back maybe a year and a half ago that says Connecticut is the state to watch and how we're spending our COVID dollars. And they wrote about the Research Collaborative and then came back to do this particular report. So appreciate it, and just want to wrap up by saying none of these things are done in isolation. So certainly appreciate. Another piece that Kari, what the home visitors are able to do is connect families to resources, right? Which is a really key part of it. And so to the extent that they have information about housing or they have information about social services, those are the kinds of things that our home visitors are doing. So it really takes us back to the space of our Interagency Council and the work when we talk about addressing the achievement gap or the opportunity gaps, it is all of us in it together. And so I appreciate that. Appreciate, Lieutenant Governor, your leadership in this space for all of us together. We're getting kids back in school, and on behalf of the 513,513 students in our education system, thank you. So that is it. I think that was the last slide. Kari, so we can take that down. I think that was it.
Yep.
So back to you, Lieutenant Governor.
Yeah, absolutely. I just have a question. So how many students actually, or how many families actually got home visits? Was every Alliance district doing this for every child or student that wasn't attending regularly, or was it just selected schools, selected cities?
So
Go ahead. Go ahead, Justin.
I'll start and then you can jump in, Kari. So, Lieutenant Governor, it's a great question. We, the initial funding actually that came from the Governor's Emergency Education Fund for $10 million, we identified 15 districts. And to your point, many of them are Alliance districts, but there were 15 in total. And the number that Kari showed on that one slide at 8,700 or something, and the new number, or the new estimated number of students who received home visits was just over 12,000. And of those 12,000 students, they received close to 27,000 visits or contacts. So it continues to expand. And again, through additional ARPA funds, we're continuing to work with those districts, actually now 14 districts, to continue that work.
Okay, and it looks like Steve Hegedus has a question. Stephen?
Yeah, thank you, Lieutenant Governor. I actually had two, if I'm allowed.
Oh, go ahead. You are.
Thank you. The first one I have is, is there a link between the two presentations? I think John had mentioned there is a connection. So in your, I haven't read the full report, but do we see trends that the reasons for for the absenteeism is connected with physical and/or mental health issues, or is it, is that a main predictor? And my second question, somewhat related, I'm hearing a lot and working with school districts of the teacher absenteeism as well, and having those two compounding effects plus learning loss is a major concern. I wonder if there's work to be done. It'd be different kinds of work, but similar work with teachers, and whether that's already begun.
So, Stephen, what great questions, and I can start off. I know my colleagues may be able to jump in here as well. And we recognize, when we talk about investing in the behavioral health, mental health, physical health, social, emotional health of students, I always say student and staff. That is really important that our staff are also getting supports as well, because we know that that is important. And we recognize, I believe, that we've looked at, and we do report out, as if I'm not, teacher absences as well. And, we've heard anecdotally about folks, when you may have substitutes or others and you don't have the same level of engagement and connection, and we know that to be true. So the issue of staffing and shortage is one that is also cannot be disconnected to the work that we're doing in that space and supporting our educators. So I think it's really important that it's both and, it's all of these together that I think is really so important. And so you're correct that addressing those needs across the board are really important work that we're doing. And we have a list of initiatives around that, be it the grants to get more behavioral or mental health support in our schools, But also what you've heard me, our big audacious goal is also addressing, connecting with community partners and others so these supports can be in our school buildings, again, not just for students, but also for staff. And that is really important. We know we've heard from our teachers about the struggles and the burnout, all of those kinds of things that needs attention, that we're really working very hard to do. And also to add, Lieutenant Governor, the governor's budget does budget additional funding for the LEAP program moving forward as well. And some of our districts, I was told, John, that are not a part of the 15 are beginning to get some training around implementing the LEAP model using other funds outside of the grant funds in this case. And so, Ajit, I don't know if you want to jump into the other question that Dr. Hedigas had asked.
I'm not sure if I can, could you repeat that, Stephen? I mean, in terms of I know you talked about the connection, but is there anything?
Yeah, did you see any trends between, between the physical mental health and the absenteeism? So is it when they did the visits, is it largely that issue, or are there other issues that are major factors in why they're absent? And then the other question the commission has begun to address, then the links with teacher absenteeism, burnout, that's ongoing. I understand that. I have a student here who's looking carefully at that in her own district for part of a dissertation about connections in burnout and absenteeism using an inventory. And I think we've also got to put a leadership lens on some of this work as well. And how can we help in teacher preparation, educator preparation, as well as educational leadership?
On the quantitative side, the answer is no. We didn't look at any sort of factors, reasons for absences and removal of those barriers. But Kari, I don't know if you wanted to chime in from the qualitative side, sort of to say like what might be some of the reasons why students weren't most common reasons, if you will, that you heard from that work and that helped to get them back in after a LEAP intervention.
Yeah, well, when Dr. Sosa was presenting, she sort of our peaks in chronic absence rates followed her peaks in COVID. Last year it was in January, and this year it came early in December in the respiratory illnesses, and that was the same with our chronic absence rates. Were higher in December and came down in January, just similar to hers. That's just my own observation. But really, it's a lot of the issues are situations in family households or disengagement from school, falling behind in school, credit recovery, losing credit because they've missed too much school. If a student is out with COVID-19 for a week or longer and they come back to school, they're behind. And if they already were feeling a little shaky in class, that might bring on some more of this mental health issues around feeling anxious around school. The home visitors can tell you lots of stories. One mother works third shift, and when she comes home from school, she said, my son's always late or doesn't come to school because I have to make him breakfast and I have to get him to school and I've got all this other stuff. And the home visitor was able to say, well, we can make him breakfast at school. You don't have to make him breakfast. Just bring him to school and we'll get him breakfast. And that student had improved attendance with that connection with that family. Just sharing one home visitor, in fact, the one who was on the video, Claudia, she shared with a grandmother who said, I'm afraid to send my children to school. I'm scared. And Claudia said, I'm scared too, but this is what I know. And if my kids are going to be successful, they need to be in school every day, and really worked with that family to understand what was truth and what was sort of perceptions around the illness. And those students are going back to school. There's many, many reasons, but lots of them are listed here, Dr. Hegedus. And from what I hear, a lot of it has to do with triple respiratory threat and then the stress and mental health.
The other thing I just want to bring us back to is we can't overstate the importance of building those trusting relationships. In large part, that first home visit was an indication to the family that somebody cares that their child comes to school, right? Someone's coming to my house to let me know, like, hey, we want your child in school. We want you in school, right? And I think that's a huge part to say, it matters. We notice when you're not in school and we want you in school. And I think that's what Kari talked about, is that's the foot in the door with the conversation with families about that. And the other stuff is just problem solving. You know what I mean? And that relationship piece and that we want you in school is a critical part to have families. And that also underscores the data that Ajit mentioned, that it didn't matter so much whether it was a teacher or a pair of teachers that went to the door, or a teacher and a community-based home visitor. It's folks that cared about that family and cared about that student.
I'll add as well, John, that care was taken for home visitors. They're not coming way out of the community and just coming in as a job, but that they have a connection to the community and connection to the families. Even language, right? Making sure that they, were folks who were bilingual, or the language of the families that they're connecting with. So that shows the care in making those connections, which I believe make all the difference for building those relationships, trusting enough to be vulnerable, right? To say, I've got this issue that I need support with, and those folks are able to be supportive.
One area that they were helpful with was the FAFSA applications. A lot of families who may not be documented are afraid to put their information into FAFSA, which can be a barrier to going on to higher ed. And the home visitors were able to actually work with the families and help them do their FAFSAs and feel trust that they'll be safe.
I put a link to the full report too, Dr. Hegedus, and you'll see in there that, page 16 actually does a little bit of a documentation of reasons why students were absent. And the important thing they caution against is not to think of it like from a kid deficit perspective. There's something wrong with the kid or something wrong with the family. That's completely almost never the case. It's always like some combination of factors. And in fact, even with remote learning, we had remote learning obviously in spring of 20, and then in 2021, it was kind of like parents could opt into remote learning. So partly it was like, now that you have to come to school, why do you have to come to school? Why can't I just get what I got before? There's like, just working through that with certain families was important. And of course, we have oodles of data that show attendance was better when kids were in person, achievement was better, emotional mental health. All of those things were obviously better, but just for some parents, it might have been just confusion around that. Like, why can't I just get this? Why do I need to come back? What are the advantages? And so partly it's that building that relationship, and it's not just one profile of a kid who's chronically absent. The kid's not just lazy and sitting home, not wanting to come. It's way more complex than that.
Sure. Yeah, thank you. That's really helpful. Seems like one visit alone could have a major impact if you're looking at scale. So, that's a takeaway. Thank you.
Thank you.
All right. Thank you all for that presentation, John and Commissioner. We are going to first, before we get to next steps in our meeting schedule, talk a little bit about legislation. So what I'm going to do is I'm going to call out the various agencies, and if there's someone from that agency who would like to share what legislation they've submitted or are watching, we'll do that. And of course, the focus should be on what should our council be watching as it affects opportunities to enhance educational achievement. So judicial branch, Kari, do we have anyone from judicial here?
Yes, I think we do. Did I?
Okay.
Hi, good afternoon. This is Patricia Nunes. My apologies. I did just log on a little while ago. I had another meeting conflict, but it's nice seeing everyone today.
And so what the question was, is there legislation that the judicial branch is aware of that would affect this council?
So I'm not aware of any pending legislation. I know there was newer legislation that was passed that created an juvenile justice education unit within the Department of Children and Families. So I just think that it's important to, and I believe that DCF presented a few meetings ago, but I think it's really important to keep on top of the work being accomplished by that new unit, right? Because it's really imperative as our youth transition in and out of residential, congregate care, and juvenile justice centers, right? That linkage and welcoming back into the educational systems in our community is crucial for success of those students.
Great. DAS.
Thanks, Lieutenant Governor. We're plenty of tracking on our end. There's no pending legislation that we proposed. We are watching legislation such as SB1 and some probably more minor bills concerning student data privacy, but nothing of large impact for this group.
Okay. DCF.
Not for this group, Lieutenant Governor.
Okay. And DECD, unless somebody has joined us, I know that we didn't have anyone from the start. Okay. SDE.
So as you can really imagine, lots in the ether for education that we're watching, specifically our own agency bill, which may not be indirectly, because we're really looking at addressing teacher evaluation and looking at teacher certification as areas that we're working on as we're addressing the pipeline and the educator core. And we know how important that is in this space, as we want to attract as many candidates, that qualify and wants to be in this space. And we have young people who wants to get into this space as well. We want to attract them. So it may not be directly in this space, but just want you to know that those are things that's on our radar as well. And as somebody else said, we have a long list of education bill proposals that we're certainly watching out there, and we'll bring to this space as we move forward.
Yes, trust me, as a former legislator, I know that there's always a lot of sausage at the start, and then somehow many of the pieces of legislation either get combined or never get past the committee process. So I definitely understand that. Department of Housing. I'll let Shante chime in, but I'll just say that the governor in his budget proposal has proposed to invest $600 million in housing programs, including time to own, incentives for workforce and affordable housing. And I did notice that housing was on one of those lists of issues affecting families. It's hard to stay in school if you don't have a home. So we are, I know that we have a big focus with the intent to, over the next 2 years, build 6,400 new homes. And I don't know, Shante, if you want to add anything else to that.
Well, I appreciate that, Lieutenant Governor. You kind of summed it up right well. The Time to Own program, we're very happy about that program and how it's moving forward in our partnership with CHAFA, because we do know how important, and indeed, I noticed it was on the list. I was very happy to see that, because it is vital. Students need stable homes. We feel obviously at DOH it starts there, and I know I can speak, I think, on behalf of OEC and SDE on that as well, given our partnership for the Head Start on Housing program. So I'm looking forward to working in that space as well with the Time to Own. And at any point, if we can kind of dovetail that, that would be awesome, because home ownership definitely makes a huge difference in that sense of pride and belonging. I noticed that belonging was also one of the issues, and having a sense of belonging makes a huge difference for students. Oftentimes their absenteeism is because they don't feel confident, they don't feel like they belong in their respective school environment, or if they're bused to another district. So I think that makes a huge difference, and it also provides that stability that we know as students and adults we need. So yes, I echo everything that you said, Lieutenant Governor, and you'll be hearing more from us moving forward on these programs.
Great, thank you, Shantae. Do we have anyone from DPH who would like to talk about DPH related? I don't know if
I'm
Dr.
the only DPH person, and I have nothing to add.
Okay, no problem, no problem. Okay, OEC.
I don't think there's anyone from OEC on today.
Okay, so we'll go to Andrea Barton Reeves, Commissioner of DSS, or one of the DSS folks.
Yes, thank you, Lieutenant Governor. We're just monitoring what seems to be an enormous volume of testimony and sort of legislation, and always continuing to look for ways that we can expand our Medicaid waiver to provide more supports for families. In particular, we have a focus right now on developing what's known as an 1115 waiver to create more food security and access to food in communities, which also helps to stabilize families, because when children are fed and they're stabilized, then they can better engage with their education.
Right, and I would just say we did pass in special session the bill to ensure that there would be free lunch across every school district for every student, which is great. And then I am sure we will be having that conversation next year. Or I'll make sure we have that conversation next year. All right, state colleges and university system.
I can speak to, excuse me, I can speak to some of the work that my colleagues and I are doing within the colleges and universities with respect to teacher preparation, and particularly dealing with the teacher shortage crisis that we have here in Connecticut. We have, there's a consortium of public and private universities and colleges that meet. We are the American Association for Colleges of Teacher Ed. I was the state chapter president for several years, and we've worked closely with SD in the governor's office last year to receive some funds to help offset some of the financial burdens our students have in meeting additional costs in their preparation programs. But this year we've met so far with the co-chairs of the Appropriations Committee, the Education and the Higher Education Committee co-chairs, to really push for investment into teaching and teacher preparation in our state. That would ballpark estimates just for the number of candidates that have completed programs in the past few years. Conservative estimates of funding that alone is between $30 and $40 million. And so that's the sum we're using. We have a recruitment issue. That's a major issue, particularly in areas of special education, special services. Here in New Haven, the superintendent told me that they have over 117 vacancies middle of this year, and that's never been that high in her time here. So there needs to be a collective effort to shift the mindset and the perception of those entering into the profession. We're seeing a lot more career changers move in and less high school students and pathways. So we want to be sure that at least the financial incentives are there, and the perception, working closely with schools and school districts, because we don't want to see the teacher shortage compound with these other factors of absenteeism impact the future of our children's education. So that's where we're keeping busy, and we look for your support as well, Lieutenant Governor.
Oh, my goodness. Yes, we have a lot of towns and cities that want more education money, and we know that our college and university system have all their requests in. So we will be working on all that in negotiation with the legislature. And OPM, is there anybody from OPM who wanted to?
No, there is not. Holly was going to be in some appropriations workshops today.
It's a busy time here.
Yes.
Okay, so I think that is there anybody else who wants to report on legislation? I hope I called all the correct departments. Anybody else? Okay. Then we will go to next steps. So as we always say, if you are working on or you are aware of a topic that the council should consider, please let us know so that we can put it on the agenda for a future meeting. And so now we can move on to next steps. Our quarterly meeting dates for the rest of the year will be June 20th, 2023, September 19th, 2023, and December 12th, 2023. For our June meeting topics, we tentatively have the rollout of the EdSite data portal by the State Department of Education. And we are also planning to invite OEC to share its thoughts on the importance of continuity of learning between grades and where play-focused education becomes lost. And we are going to have Kari and Christine working with the State Department of Education, OEC, and any other agency that we might need to present on those topics. So again, if you have any suggestions for guest speakers who can offer a particular insight on topics related to our council's work, feel free to let us know. And I'll ask if we have any comments or questions. So, Madam General Counsel, I am not seeing any hands raised.
Nope.
Okay, so I want to say thank you on behalf of Governor Lamont and me for all of the great work that you all are putting in this legislative session and every day. We really appreciate your dedication, and thank you for helping us to make Connecticut a leader on so many fronts, but particularly in education. And we'll see you at our June meeting. Thank you so much, and our meeting is hereby adjourned.
Thank you.
Take care, everyone.